I'd like to introduce Susie from Wales, and she takes LDN for multiple sclerosis and breast cancer. Welcome, Susie.
Thank you.
When did you first start to notice MS symptoms?
With hindsight, I realised that I started getting symptoms in my mid-20s after a bout of glandular fever and hepatitis B injections, but I didn't start thinking, oh crikey, there's something wrong with me that I need to address until after my daughter was born, which was in 1998.
What sort of symptoms did you have at that point?
After my daughter was born, well, things that I thought maybe were postnatal didn't go away. So the symptoms I had was weakness in my legs, difficulty standing and walking, lots of strange sensations, you know, the bog standard MS stuff, things creeping and crawling up and down my arms and my leg and my back. I had episodes of extreme vertigo where I couldn't walk. I had nerves in my face and head and neck affected, so I had, to all intents, a kind of Bell's palsy. I lost the sense of taste and smell for a while. I had so many symptoms. I had optic neuritis, of course. Everybody gets that. I went sort of 80% blind in my left eye, which did return a few years later. What else? Lots of very painful spasms and kind of like extreme cramps in my feet, my legs, my hands. And it just all got worse and worse till eventually my walking was kind of shuffling. I wasn't able to hold a pen. I couldn't read because I had such bad nystagmus. Slurred speech, continence problems, bowel and bladder problems. Things like that. Those are the ones that come to mind first of all.
So what did your doctor do? What medication did he offer you?
Well, at first we weren't sure what it was, so I had a stream of investigations. They first of all thought I had Cushing's syndrome because my cortisol levels were so high. But to cut a very long, boring story short, the story which most MS sufferers go through of trying every other diagnosis under the sun. Eventually, I think it was the optic neuritis made them question MS. And so they sent me for an MRI, and the MRI came back clear, and they said, we're 99% sure you haven't got it. Don't worry, go home, everything will be fine. Symptoms carried on getting worse. I had episodes where I got really very ill. After about a year, I went back to the doctor and said, do you really not think it's MS? And he said, actually, I do think it's MS. What do you want to do about it? And I said, well, I understand that the treatment on offer via the NHS is either beta interferons, steroids, or combination thereof. And I don't want to take those things because, having a medical background myself, I knew, the side effects and that they're not particularly effective in MS. I've looked after a lot of people with MS in the past who've been on them. I did take steroids when I literally couldn't walk at all because as a single parent, I had a responsibility to be fit enough to take care of my daughter. But I only did that for just one very short phase, just to get myself back on my feet and able to walk again. But after that, I decided not to go for a diagnosis and not to go for treatment because I just didn't think that the treatment available was going to be of any help. The doctor's advice was go and live next to a bus stop. That was the hospital doctor, not my GP. My GP was very supportive and basically said, he'd support whatever decision I made or whatever treatment I wanted. But that was what the hospital doctor said.
Well, I hope he thought he was being amusing.
No, she was genuine.
Really?
Yeah.
So, what did you do next?
Well, I sort of carried on ignoring it, and I moved to Swansea because my daughter got asthma, so I wanted to live next to the coast. And then I got to the stage where I thought I have to try and do something about this. And a friend of mine had a client with MS who was an occupational therapist, and she said that her friend did lots of alternative things, and that what she was managing her condition using alternative treatments. So I phoned up this friend, and she told me about the Multiple Sclerosis Resource Centre. I phoned the Multiple Sclerosis Resource Centre, and they sent me an information pack. As a result of that information pack, I got Judy Graham's book, you know, which talks about all the different treatments that you can go for. And I read them, decided that there were certain things that scientifically made sense and therefore were worth a shot, and was really quite annoyed that nobody told me all these things, you know, when I first was ill. And then I got New Pathways magazine as a result of joining the MSRC, and saw a picture of Bob Lawrence, and noticed that his phone number was a Swansea number. So I thought, aha, it would be very good to speak to a GP who's got MS. You know, I felt it would be really useful for me to speak to somebody who kind of understood. So I phoned Bob up. He did the most detailed medical history of anybody that I've ever seen. I think we were on the phone for about 4 hours. And at the end of that, he recommended that I consider the dietary changes that the MSRC recommends. He didn't recommend the best bet diet, but a sort of version thereof. And he also recommended low-dose Naltrexone. So both of which I went for.
So when you first started LDN, did you have any initial side effects?
Yeah. The first dose I took, that night, I was able to read. I read a book from cover to cover, Chocolat. I never forget it.
It's a good book. I've read it too.
I know, it's just amazing. I mean, having not been able to read, you know, properly, I mean, I could read things like, you know, I could focus enough to sort of work out what was on the television that night. But even then, that was a struggle, you know, and I'd have to magnify things. And so I read this book from cover to cover, and that was just amazing. The only detrimental side effect that I notice ever from LDN is like sleep disturbance. But I didn't notice that at first because my condition meant that my sleep was so disturbed anyway because of all the spasms and pain and strange sensations and going to the loo all the time that really the sleep disturbance from the LDN was kind of negligible in comparison.
So what did you notice first of all with the LDN, and how long did it take?
Well, like I said, the first thing was my eyesight. What I noticed was a reduction in the psychological confusion, you know, the brain fog seemed to diminish. I had more energy. I was able to control my walking better. I was able to, you know, pick my feet up and take better steps. I didn't fall so much. I could hold a pen and write. And sort of gradually as the weeks carried on, the spasms decreased. I lost loads of weight, which was a surprising thing, which, you know, but maybe simply because, you know, my body wasn't in kind of emergency mode anymore. I don't know. The improvement with the vision didn't stay at quite that level. It kind of deteriorated a bit again, but it's never gone back to as bad as it was. And the nystagmus never returned. I stopped being frightened to go to sleep. I mean, that's one of the really big differences, you know, that now I don't expect to wake up X number of times a night yelling the place down with sort of muscles tearing and things. I mean, it's completely life-changing. I'm sure that if I wasn't on the LDN, I wouldn't be mobile anymore. And although I do walk as though I've been drinking gin all lunchtime, I am walking, you know. Yeah, it was absolutely life-changing.
You mentioned all the other awful symptoms that you had. Which of those symptoms are still there?
I still have kind of mild versions of the symptoms, you know. I can't walk that far. I do get very tired. But at least I am still walking. I can get my mobility scooter in and out of the car, whereas before there's no way I could have lifted it. Sometimes I use a stick, sometimes I don't. I have symptoms. I still get periodic problems with my bowels and bladder. And like all MSers, I know every toilet in the country. But it's not nearly as bad as it was. Everything is just, I'd say that I'm kind of 75% better than I was before I went on the LDN. Feeling is that if I'd discovered the LDN sooner, I probably wouldn't have been left with the residual disability that I've got. Mm-hmm. That's obviously pure conjecture, but that's my feeling. For a while, I was unable to get LDN, and my health deteriorated really very severely. It was gradual and took about 3 or 4 months to go right downhill again. And then when I was then able to get the LDN and restarted it, I gradually improved again. But I never improved to the level I was before I stopped it. So what I'd say to people is get on the LDN as quickly as you possibly can.
And then unfortunately you were diagnosed with breast cancer.
Yes. Oh, joys, joys.
Being greedy there. Would you like to tell us what happened?
I had a very stressful experience, which I won't go into at the moment because it's really boring, but at the end of that experience, I found a 5 centimetre lump in my left breast, which had appeared, it had gone from non-palpable to being able to palpable within 2 weeks. So I knew it was something serious, and I knew that it wasn't a cyst or anything like that because of the way it felt and things. So do you want me to talk you through?
Yes, do.
I went down to my GP. I said I found a lump. She had a feel. She thought the same as me, referred me to the breast care service at Swansea Hospital. They have a statutory responsibility to see people within 2 weeks of an urgent referral. So on the 13th day, I think I got seen, by which time the growth had already increased. They did a mammogram followed by an ultrasound, followed by 8 core biopsies, and they were pretty convinced it was malignant. So was I. I got the results, I can't remember, within a fortnight or something. Not as quickly as you'd imagine that one should in those circumstances. I had to bellyache to get it's a really long story, but basically there are statutory time limits to getting the operation, but everybody falls under the same umbrella of those time limits, irrespective of the speed of the growth or what type of cancer it is and things. So basically my surgeon couldn't fit me in soon enough, and it was growing. So eventually Guy Lloyd, who's the assembly member for this part of Wales, kicked some backside with the help of Edwina Hart, and I managed to get the operation. But it took a long time, and I was getting very anxious that whilst I was waiting it could spread. And by the time I was operated on, it was 3 centimetres bigger. During that time, I was trying to find out what would be the best treatment, and I found out about the work that Dr. Bert Bergson's doing in New Mexico, using alpha lipoic acid and LDN and vitamin B and things. And also I read up and emailed with Ian Zagon I think he's in either Philadelphia or Massachusetts, or maybe he works out of both universities, I can't remember. And he works using LDN in combination with chemotherapy. Because the tumour turned out to be HER2 positive, they wanted me to have chemotherapy, and it turned out that I wasn't allowed to have Herceptin unless I had chemotherapy. All the evidence that I managed to collect pointed towards the fact that probably if you take LDN, you need a lower dose of chemo, and also that the LDN helps deal with the side effects and the recovery from the chemo. My first dose of chemotherapy, I was put on docetaxel, carboplatin and Herceptin. They gave me too much, and I had a lot of really quite nasty neurotoxic symptoms and was very, very ill. They reduced the dose by 20% for the next time. Then I went into anaphylactic shock, so they stopped the docetaxel altogether. So for the rest of the treatment, I just had the carboplatin, and I took LDN the whole time. I took it. I was previously taking LDN 3 milligrams for the MS. So I got the cancer diagnosis. I put it up to 4.5, and I think probably that did me a lot of good, because between having the surgery and getting the tumour removed and starting chemo, I was actually better than I had been in a long, long time. So I'd recommend that if people can tolerate the 4.5, they go for it. I had tried 4.5 previously, but I'd actually got worse. So I'd gone back to the 3. But maybe my ability to cope with it, or maybe my body needed more, because bodies change, don't they?
Yes. So what happened then after your chemo?
Well, I'm still having the Herceptin 3 weekly. I was told, for example, that the chemo would burn out my ovaries and I'd go into menopause. And whilst I was on chemo, I did have a lot of menopausal symptoms, but my periods have come back perfectly normally, which apparently is extremely unusual. So I do wonder if that's to do with the LDN helping the body recover. Bit of a nuisance, really. I thought I'd done and dusted the old menopause there. And I think probably, being on the LDN has helped enormously, although obviously it's all ultimately conjecture, isn't it?
Yes.
But, I do think that there are so many stories of so many people. When I was researching what was the best thing to do, I wasn't at all convinced that chemo was my best option. And I'm still not. I went for it, because I wanted the Herceptin, because that did seem a sensible thing, and B, because I just felt, although it wasn't black and white, the grey scales tipped just slightly in favour of chemo. Mm-hmm. But I think that LDN is the future of cancer treatment, possibly in combination with the ALAs and the stuff that Dr. Bergson's doing. I've been reading loads of different stuff about people who've had, quite advanced metastases going into total remission with his treatments, and with the stuff that Dr. Bahari was doing in New York. There's a woman who had exactly the same diagnosis as me, who's, years and years on from it. She didn't have chemo, she just had the LDN and ALAs and things.
So what would you say to other people who would like to try LDN but a little bit frightened?
Lots and lots of people. I've lost count of the number of people that have phoned me up to ask about LDN. Every one of them I have recommended that they do try it. These have mainly been people with MS, but some of them have been people with other kind of autoimmune problems like Crohn's disease or ulcerative colitis, arthritis, but also people with cancer. I mean, what I would say is, what on earth have you got to lose? Everybody I know who has tried it has benefited from it. The only people I've ever heard of who have not benefited from LDN are people with MS who don't bother to change their diet, who carry on taking stuff that has been demonstrated to be really bad for people with MS, like dairy products from cows and such like, and wheats and things. Everybody I know who's tried it in combination with sensible diet changes has benefited enormously. Some people quite miraculously, but I've never known anybody to either not have any change or to deteriorate in any way. Mm. And that's, a lot of people now, because loads of people have talked to me about it.
Well, I think we've sort of just about covered everything. Is there anything else you want to add?
I don't know who would be listening to this interview, but what I would say is try it. You've got nothing to lose. It's cheap and it's safe. And also, I would very much recommend that the professionals working in the field of both cancer and MS, and indeed any area where you're treating some sort of malfunction of the immune system, to recommend people try LDN right at the get-go before they've got damage that maybe is irreparable. I do think they've got a responsibility to recommend it. It's been used for 30 years successfully. There is absolutely no reason not to recommend it. And I think that, I've worked for the health service myself. I know how incredibly forceful and, how the propaganda that the drug companies come out with you just think it all sounds so sensible and so reasonable that you just kind of automatically believe it, because you don't think for a minute that people would be so wicked as to try and subdue or, keep something secret that is so successful. Mm. But I am absolutely convinced now that the reason that LDN is not internationally available for all these problems is simply because of the amount of money that the drug companies would lose, because people would stop using things like beta interferon and steroids, and subsequently they'd stop using all the things that then you have to then take as a side effect. For example, if you think about how much money is spent treating MS and Crohn's and all the autoimmune illnesses, and how much money goes into all the cancer services, the amount of money we could save if people used LDN would revolutionise the health service, and that money would be in the hands of, the right people rather than the wrong people, perhaps.
Well, thank you very much for sharing your experience with us. I'm sure it's going to be very inspirational for other people.